A 31-year-old Japanese man undergoing infliximab treatment for Crohn's disease was admitted to our hospital with high fever and pain in the right upper abdominal region. He was diagnosed with Crohn's disease 15 years ago when he had presented with an anal fistula, which was stable without resistant abscess for 5 years. Due to gradual exacerbation of the disease, he underwent an ileocecal resection with an ileostomy and subsequent abscess drainage around the stoma 10 years ago. A second operation for ileal stenosis was performed with a partial ileum resection and a new ileostomy 6 years before the admission. He had not been treated with methylprednisolone, but underwent infliximab treatment 2 years before the admission to induce remission because of further exacerbation of the disease. Infliximab, 5 mg per kilogram, was administered every 8 weeks for 9 times, successfully suppressing the disease. The last infusion of infliximab was administered 2 months before referral to our department. On admission, his mean arterial pressure, heart rate, body temperature, and respiratory rate were 76 millimeters of mercury, 78 per minute, 39.3 degrees Celsius, and 16 per minute, respectively. After admission, his fever spiked up to 40 degrees Celsius each day. However, his circulatory and respiratory condition was stable without vasopressor treatment or oxygen administration. Laboratory data revealed severe inflammation with a white blood cell count of 20,400 microliters, with 80% neutrophils, a serum C-reactive protein level of 25.0 milligram per deciliter, a serum fibrin degradation products level of 26 micrograms per milliliter, and a serum D dimer level of 11.6 micrograms per milliliter. His liver function was slightly impaired with increased aspartate and alanine aminotransferase levels, 87 international unit per liter and 149 international unit per liter, respectively. However, no other organ impairment was observed. The results of the arterial blood culture and serum anti-amoeba, Shigella, dysentery antibody tests were negative. Abdominal ultrasonography and abdominal computed tomography on admission revealed a huge heterogeneous lesion in the liver, 50 millimeters in diameter, occupying Quinu segment 8. Prognosis: liver abscess and Crohn's disease.